Hi, I'm Erin Gahagan.
I'm Kendall Lalko.
And I'm Holly Havens. Please enjoy our CAM therapy presentation on Saw Palmetto.
Today we will be talking about Saw Palmetto and how it will not have an effect on lower urinary tract symptoms secondary to benign prostatic hyperplasia. Saw Palmetto, also known as Serona rapens, is indigenous to the southeastern United States and the West Indies Islands. It is also known as palmetto shrub or cabbage palm. It was a staple food for the Native Americans in the southeast and was also used for medicine. In the late 19th century, interest began to grow when it was seen to have positive effects on urinary tract problems of livestock. The saw palmetto plant produces small white flowers in the spring and a small berry that is harvested and dried in the fall. Lipophilic extract is thought to contain the medicinal qualities and is removed from the dried powder. Native Americans used to use it for impotence, inflammation, infertility, and expectorant. Today, it is used for benign prostatic hyperplasia, natural breast enlargement, infertility, hair loss, and androgenetic alopecia. Benign prostatic hyperplasia is classified as an enlarged prostate and usually occurs in all men as they age. The enlarged prostate may then press on the urethra and cause problems within the bladder and with urination. It is important to note that BPH does not increase the risk for prostate cancer. In 2004, sales figures were $20,334,000 and was ranked third in the United States for herbal supplemental sales. An average bottle of 90 pills, which will last roughly 3 months, will cost the consumer anywhere from $11 to $20. It is actively advertised by many brand names such as Nature's Aid, Prostaset, Ultra, Life Plan, Sundown Naturals, and Prostcare. The biological aspects of saw palmetto are the lipophilic extract, which has an anti-androgenic effect. It inhibits the binding of DHT to androgenic receptors in the prostate and prevents accumulation of steroids, which may lead to the prostate hyperplasia. Saw palmetto has an anti-estrogenic effect, which lowers cytosol and nuclear receptor values for estrogen and can inhibit stromatic prostate growth in patients with BPH. The alcoholic extract has an anti-inflammatory effect. Inhibition of synthesis of arachidonic acid, inflammatory metabolites. There are safety warnings when taking saw palmetto with specific drugs. The safety warnings include dizziness, headache, indigestion, nausea, stomach pain, bad breath, vomiting, constipation, diarrhea, possible liver or pancreas damage. When taken with anticoagulants, saw palmetto may slow blood clotting, and when taken with birth control, saw palmetto may decrease estrogen levels in the body.
For this project, we analyzed 3 studies measuring the effects of saw palmetto on BPH. The following are criteria used to diagnose and assess its severity. The International Prostate Symptom Score, IPSS, is a short questionnaire that asks about specific urinary symptoms associated with BPH or enlarged prostate and how often they occur. Scores over 12 are indicative of BPH. Digital rectal examination allows the physician to get a general idea of the size and condition of the prostate. Serum creatinine and blood urea nitrogen can be obtained from blood tests, and serum creatinine more than 160 micromoles per liter is indicative of BPH. Serum prostate-specific antigen, PSA, blood tests are also used to diagnose BPH. PSA is a protein produced by cells in the prostate, and the level of this protein is elevated in the blood of men who have prostate cancer or BPH. A serum PSA of 4 nanograms or less is indicative of BPH. Urinary flow studies measure the strength and amount of urine flow. Maximum urinary flow rate, MFR, is determined by dynamic uroflowmetry. MFR less than 15 milliliters per second and avoiding volume of less than 150 milliliters is indicative of BPH. Relative urinary resistance equals the time of urination divided by MFR. The first study we looked at, entitled Saw Palmetto for Benign Prostatic Hyperplasia, is a study that was published in February 2006 in the New England Journal of Medicine. This study used a sample size of 225 men over the age of 49. These men all had moderate to severe BPH symptoms. Participants received either 160 milligrams twice a day of either Saw Palmetto or the placebo for 1 year. The primary outcomes were measured using the American Urological Association Symptoms Index, AUASI, and the maximal urinary flow rates. Statistical findings included that the AUASI mean change was negative 1.49, with a 95% confidence interval. Within the treatment group, AUASI decreased by a mean of 0.68 with a 95% confidence interval. The placebo group showed a mean decrease of 0.72. In the treatment group, peak urinary flow rate changed by a mean of 0.42 milliliters per minute with a 95% confidence interval. In the placebo group, the mean difference was 0.43 milliliters per minute with a 95% confidence interval. The results of this study showed that there is no significant difference between the treatment group and the placebo group. We graded this study as an A+ because it was a randomized, double-blinded clinical trial with a large sample size. The second study we looked at, entitled Effects of Saw Palmetto Herbal Blend in Men with Symptomatic Benign Prostatic Hyperplasia, was published in 2000 in the Journal of Urology. This study used a sample size of 44 men from the ages of 45 to 80 with symptomatic BPH. It was a 6-month randomized placebo-controlled study. Participants received one 106 milligram tablet of either Saw Palmetto or placebo 3 times a day with meals. Endpoints included routine clinical measures, blood chemistry studies, prostate volumetrics, and prostate biopsy. They noted prostate epithelium contraction in the treatment group, which decreased from 17.8% at baseline to 10.7% 6 months later, with a p-value of less than 0.01. Also in the treatment group, the percent of prostate considered atrophic using 4 times magnification inspection increased from an average of 25.2% at baseline to 40.9% 6 months later, with a p-value of less than 0.01. There was a mean decrease in IPSS of 16.35 to 13.3 in the placebo group, and a mean decrease of 18.43 to 12.85 in the treatment group. The results showed that there was a significant statistical difference between the groups. We graded this study as an A- because it is a randomized, double-blinded clinical trial. However, the sample size is very small. The third study we looked at, entitled Effect of Saw Palmetto Soft Gel Capsule on Lower Urinary Tract Symptoms Associated with Benign Prostatic Hyperplasia, a randomized trial in Shanghai, China, is a study that was published in February 2008 in the Journal of Urology. This study used a sample size of 92 Chinese men between the ages of 49 and 75. These men all had lower urinary tract symptoms associated with BPH. It was a randomly assigned, double-blind, placebo-controlled trial. The treatment group received 2 Prostaplex soft gels daily for 12 weeks. The control group received 2 placebo soft gels daily for 12 weeks also. Statistical findings included increased MRF in both groups, decreased RUR in both groups. An IPSS decrease of greater than or equal to 3 was noted in 18, 39.1%, of participants in the treatment group, and 1, 2.2%, participant in the control group. This was determined using chi-square analysis and p-value of less than 0.001. The results showed that MFR was significantly higher in the treatment group, RUR was significantly lower in the treatment group, and that there was no significant difference in mean prostate volume or IPSS between the 2 groups. We graded this study as an A because it is a randomized double-blinded controlled trial. However, the sample size is not especially significant. Some limitations to the studies we used include participant compliance, participant follow-through, small research samples, and some inconsistent data. With this in mind, we determined our overall project grade of evidence: Level 2 for quality, Level 1 for consistency, Level 1 for quantity, Level 2 for clinical impact, Level 2 for generalizability, and we assigned our overall project a Level 2 grade.
Daily, the public is exposed to the popular ideas of herbal supplementation and their proposed benefits. There have been many scientific studies done, and most either do not agree with the popular health claims or are highly inconclusive. Based on our research, we recommend that Saw Palmetto does not have an impact on treating the symptoms of BPH. Contraindications to the popular media health claims do exist, and while we are currently recommending to not take Saw Palmetto to improve the BPH symptoms, the following are things to look out for if one does decide to take it. There can be significant drug-nutrient interactions and side effects, as we discussed earlier in the presentation. Drug-nutrient interactions can include anticoagulants and high doses of estrogen, such as birth control, and can cause negative side effects when taken with Saw Palmetto. Side effects, a few are reported, and in addition to the ones we did discuss earlier, there are also GI distress, asthenia, a decrease in libido, dizziness, ejaculation disorders, headache, and postural hypotension. According to the research we've done, headache was the most highly reported side effect. Before beginning any type of supplement regimen, it is suggested that one talk to their healthcare provider, and if side effects do occur, that would be another time to visit them as well. Federal regulatory agencies do not currently regulate supplements, and many discrepancies occur between supplement companies and these federal agencies. One example is the National Institute of Health. They recently came out with a statement stating that Saw Palmetto is likely unsafe to consume during pregnancy or breastfeeding. The U.S. Food and Drug Association, also known as the FDA, currently in 2003 had a court trial called Whitaker versus Thompson, where the FDA claimed that it would not put a health claim out on Saw Palmetto to say that it improves urine flow, reduces nocturia, and reduces voiding urgency associated with mild BPH, as requested by supplementation companies. FDA maintained that the claim related to an effect on an existing health condition, and as a result, it was not within the statutes defined of a health claim. If they put this on the product's labeling, it would have to be considered a drug, which it is not. It was determined an unlawful drug claim, and the court sided with FDA statements. For more details on this court case and other announcements from the FDA, more details can be found at fda.gov. In conclusion, Saw Palmetto is a very popular, highly used, and highly discussed supplement that went from being used to feed and medicate Native Americans to becoming a cure-all for all things from BPH to hair loss to acne and to natural breast enlargement. And while many studies have been done, we determined from the research we conducted that while this supplement is believed to do many things, there is no conclusive research that guarantees any of the popular health claims to be true. But besides this fact, many men continue to take it for their BPH symptoms in hopes that it will relieve or possibly even cure their condition. With all supplements, we highly recommend that those who can begin to take these supplements do their research and know the facts before beginning any type of regimen, medication, or supplement-wise. Finding our references was fairly easy because a lot of research has been done, but like we've said many times, it is highly inconclusive or in disagreement with the proposed benefits. We have learned a lot about CAM therapies from conducting this research and doing this presentation, and we hope that you take away some knowledge that you did not know before watching our presentation. This slide contains all of the references we used to put together this CAM therapy presentation on Saw Palmetto. All articles and websites can be accessed via the World Wide Web. Thank you very much for your time and allowing us to share our knowledge with you.